Welcome back to Emergency Chaos, where we provide tips and tricks to help you become the best ER nurse you can be. Today, we're going to go over super quick how to go about handling that overwhelm of the ER. So, new ER nurses are expected to feel overwhelmed. It's completely normal to feel overwhelmed. There's so much to learn, so many medications, so many conditions, so many procedures, so many just everything is going to be thrown at you at once, and it is very overwhelming. Again, it's part of the process. Know that it's just something that comes with coming to the ER. And as long as you build a solid foundation, as long as you put in the effort, this overwhelm will slowly subside and you will start to gain confidence that you can handle whatever comes your way. Do be aware that the confidence doesn't come to like a year, 2 years, but typically it takes around a year for you to start feeling remotely confident. By that point, you've seen enough, you've experienced enough, you've given the meds, you've seen the conditions, you've seen the procedures, so you start building this working knowledge, this solid understanding of emergency nursing, so that you know that whatever comes through those doors, you're gonna at least have a good knowledge of the basics and you can go from there and take care of your patients and provide safe care. But again, it is overwhelming in the beginning, but just the best thing we can do is accept it and keep moving forward, taking it a shift at a time and then focusing on the essentials of the ER. So the best things that you can focus on is having a good understanding of the ABCs, a good understanding of ACLS, having a good understanding of the key medications that you're seeing in the ER and the key conditions that you're going to be seeing in the ER. For conditions, of course, the most important ones are going to be things like CHF, COPD, asthma, pulmonary embolism, strokes, STEMIs, seizures, DKA, brain bleeds, ODs, right? For medications, keep in mind things like vasopressors, fluids, benzos, sedation medications, and so forth. Keeping at least a basic understanding of each, reviewing the basics of each so that when you see them out in the real world, out in each shift, you can put everything together and overall build a better foundation for yourself. For example, if you're reviewing CHF, review how BiPAP is very important, how nitroglycerin is very important, and how Lasix is very important as far as the treatments for these patients. If it's COPD, review albuterol, magnesium, CPAP, steroids, and how that relates to the treatment of COPD. The same thing for asthma, albuterol, steroids, magnesium, how lung sounds, how they're expected to go from wheezing to not wheezing, how to monitor them, and overall how to ensure that you're catching if they're getting worse. For pulmonary embolisms, just review heparin drips, review the questions that you need to ask. Know that it can start as a DVT in the legs and then move up to the lungs. And heparin drips are going to be used if the patient's still stable, and what happens if the patient becomes unstable on a with a pulmonary embolism. What are the next steps? What's done for that patient? Things like thrombectomy or even thrombolytics if it's like a saddle PE, but just reviewing the basics of the treatments. For strokes, remembering that there's ischemic strokes and hemorrhagic strokes, and one of the most important things is going and getting a head CT so that you can see if it's either a brain bleed or if it's not going to be, if it's going to be more of an ischemic. Know the time window for thrombolytics for ischemic strokes. Know that the medications like thrombolytics are weight based, so you have to get an accurate weight before that. Know that you have to get a glucose for that. Knowing what are the contraindications for thrombolytics, and again, knowing the time frames from lasting normal to be able to give a thrombolytic for stroke patients. And remember that it's 4.5 hours. For STEMIs, remember that the most important thing is getting an EKG, setting that off, getting your patient to the cath lab. If your facility doesn't have a cath lab, transferring to a cath lab. If there's no cath lab anywhere in the area, at that point you're thinking thrombolytics to help break up whatever is going on in there. Besides that, again, aspirin's also very important. If your facility has cardiology, they're going to come down and possibly order heparin before they go up to the cath lab suite. Remember to put these patients on pads because they're very likely to a rest since the heart is very irritated. Now, for seizures, remember, turn them Don't put anything in their mouth, put oxygen on them. And if you have IV access, the typical go-to medications are going to be benzos. If you don't have IV access, it's still benzos. Just if it's IV, it's going to be Ativan. If it's IM, it's going to be midazolam. And just how to make sure that you're monitoring for ongoing seizures and if these patients are going into status and it wasn't just like a one-time thing. Remember for DKA, the most important things are going to be a bunch of fluids, and then getting insulin on board and keeping an eye on the potassium. Because remember, if you give insulin, potassium gets shifted into the cell, so you have to keep an eye on the potassium and overall supportive care for these patients and checking the glucose regularly and checking the gap regularly and the electrolytes regularly and so forth. For brain bleeds, remember it's going to be your blood pressure goals of 140. If you need to do pushes of medications to bring the blood pressure down, labetalol is often a go-to medication. Initially, you just have to keep an eye on the heart rate. If they need an infusion, of course, it's going to be most likely cardine. But again, reviewing all these, reviewing the basics of each, and just having a working understanding of them so that when you see them in the real world, you can kind of put everything together. And so, again, the most important thing is to take it a shift at a time and keep the essentials in mind. When you get a new patient, you have to get them on the monitor. That includes putting a blood pressure cuff on, the SpO2 on, the cardiac leads on, so you can get a full set of vital signs, take a temperature. If your patient's there for hypotension, put the BP cuff on first. If they're there for shortness of breath, increased work of breathing, put the SpO2 on first. If they're there for a chest pain or a rhythm issue, put the cardiac lead on first. And then if the patient's there for anything infectious, make sure that you get a good, accurate oral temperature for these patients so that you can see how that's going and if you need to treat it. And then besides getting them on the monitor, getting a good set of vital signs, make sure that you have a good understanding of the ABCs, airway, breathing, circulation, the interventions that are done for each, the assessments that are done for each. And then have a good understanding and get as much practice as you can of obtaining IV access. Without a good working IV, we can't give fluids, we can't give blood products, we can't give any benzos, we can't give Lasix, we can't give any medication if you don't have a good working IV. So remember, the essentials are going to be as soon as the patient comes in, get him on the monitor, go down the ABCs and get IV access. Those are going to be the most important things. If your patient's hypoxic, you got to get him on oxygen. If your patient's hypotensive, get some fluids going. Be mindful of things like CHF, renal patients, and so forth. But generally, if they're hypotensive, get some fluids on board. If they're having an cardiac rhythm issue, make sure that you get an EKG just to make sure that you're ruling out STEMIs, that you're looking for SVT, for heart blocks, and so forth. But again, the essentials are going to be get them on the monitor, go down the ABCs, get IV access, and address any issue that is coming up. By the way, if you're finding this helpful and want to save time and energy with mastering the chaos of the ER, check out our book and course. They're packed with everything you need, including foundational material, quizzes, and practical tips to help you feel more confident and prepared in the ER. The course comes with video lessons, real scenarios, charting guide, practice questions, and it comes with the books included. The links are in the pinned comment or description below.